Hi all, my name is Dr. Rajesh Pathi. I am a consultant neurosurgeon at OMNI Hospital, Kugatpalli. Today we are going to have a brief overview of what are the various neurosurgical procedures which are done in routine neurosurgical practice. So these can be broadly divided into three categories: those which are related to the brain, those which are related to the neck, and those which are related to the back. So coming to the procedures which are related to the head. So what happens, what are the routinely done procedures in case of head are trauma. Trauma is actually the bread and butter of neurosurgeons. So what we do routinely is patients who are having road traffic accidents, who are having bleeds or clots in the brain. So for these cases, we routinely do decompression, that is called as DECRA, which can be craniotomy and craniectomy. So what is done in these procedures is basically we'll be removing some part of the bone flap. That is, we'll be opening the skin, we'll be reflecting the flap, we'll be making drills in the skull, and we'll be removing the bone. Followed by we'll be removing the clot. And depending upon the clinical scenarios, the bone either it is replaced or it is stored in the bone bag. So if it is replaced, it is called as craniotomy and clot evacuation. If it is not replaced or if it is kept in the bone bag, then it is called as craniectomy. So that is the routinely done procedures in case of trauma with respect to the head. Next, coming to other categories where we do operate on the head is brain tumors. For this, we do pterional craniotomy. That is, we'll be giving incision here, we'll be reflecting the flap, we'll be removing this part of the bone, and we'll be approaching the tumor, that is brain tumor. So this is another routinely done procedure with respect to the head. Next would be suboccipital craniotomy. That is, the incision will be like this. We'll be approaching in this way, and we'll be removing tumors which are in the cerebellopontine angle, that is CP angle tumors. So these are routinely done procedures with respect to the head. Next, we'll discuss about procedures which are done routinely with respect to the neck. Normally, what neurosurgeons encounter in their OPDs are patients who are having neck pain, that is cervical spondylosis or cervical disc prolapse. So in these cases, initially we'll try to manage them with medicines. But what happens is when it crosses a limit, then surgery becomes mandatory. So what are the various surgeries or surgical procedures which we do in the neck are? First is anterior cervical discectomy. That is, we approach like this, we open the skin like this, we approach and then we identify the level, and then we remove the extruded part of the disc. That is, the disc which is compressing the spinal cord or the nerve roots. So we will be removing that disc and we will be replacing it with artificial disc. So that is the most routinely done procedure with respect to the neck. What is the second procedure which is done with respect to the neck is, if the disc prolapse is at multiple levels, not in the single level, but it is at more than 3 levels, then what we do is we approach the issue with the posterior approach. That is, we give an incision on the posterior aspect of the neck, we open it, we decompress the spinal cord. That is, nerves ఏవైతే compress అయి ఉంటాయో అవన్నీ రిలీజ్ చేస్తాము, and subsequently screws, rods AC so that is called as cervical lateral mass fixation. Okay? These are two procedures which are routinely done with respect to the neck. Now the next most common area where we do surgeries is with respect to the back. As you know, in almost every age group, people who are more than 30 are having complaints of back pain with respect to excessive driving or lifestyle habits or stress and strain, lack of sleep. So these are the patients who also routinely come to our OPD practice, complaints of back pain. So in this sort of cases, what we do is we do an MRI or X-ray, whatever is necessary. So depending upon the disease severity, initially we try to manage them with medicines, bed rest. Subsequently, if it crosses some point, some extent, then surgery becomes mandatory. So in these cases, what we do is we do open here, that is micro discectomy or endoscopic discectomy or open discectomy. Whatever the method is, the principle is ఏదైతే డిస్క్ బయటకు వచ్చిన పార్ట్ ఉంది, which is compressing the nerve roots, So that disc has to be removed. May it be endoscopic, microscopic or open. So excluded disc part అనేది తీసేసి so that the nerve roots compress అవుతున్న nerve roots అనేటివి we just release them. So that is the most common procedure which is done with respect to the lower back. Next procedure which is done most commonly with respect to the lower back is fixation, అంటే screws rods వేసి fix చేస్తామంటారు. When do we do this procedure is if the single disc collapse కాదు, డిస్క్ ఒకటే ప్రాబ్లం కాదు, డిస్క్ కాకుండా చుట్టూతున్న బోన్ కూడా అబ్నార్మల్ అయిపోయింది ఆర్ స్పైనల్ కెనాల్ వెన్నుపూస అనేది కంప్రెషన్ లోకి వెళ్ళింది. అలాంటి కేసెస్ కి వెన్నుపూస స్పైనల్ కార్డ్ ని మొత్తము అడిక్వేట్ గా డికంప్రెస్ చేయాలంటే ఆ నర్వ్ రూట్స్ అన్నిటి ఫ్రీ చేసి అప్పుడు మోర్ దెన్ 2 levels or 3 levels ఉంటుంది కాబట్టి we have to fix them with screws and rods. It varies depending upon the scenario. So this is the second most common procedure which is done with respect to the lower back. And there are vast numerous areas of neurosurgical practice, like for suppose brachial plexus injuries ఉంటాయి, దానికి we do some surgeries. Peripheral nerve biopsies also we take. So this is the general overview of what the neurosurgical practice is or what a neurosurgeon does in their routine practice. Thank you all for watching this video.